All right, so let's dive into something that I think is going to be really relevant for a lot of you listening, especially our endocrinologists and psychiatrists out there. We're going to be talking about mental health and menopause. It's a connection that really deserves, I think, a lot more attention than it usually gets, in everyday practice.
Yeah, absolutely.
So for this deep dive, we've got a ton of research we're going to be pulling from. We've got some really recent stuff from GMA Network Open. We've got this super practical guide to menopause management from, let's see, the Canadian Medical Association Journal.
Yeah.
Oh, and some really interesting insights, I thought, from Harvard Medical School.
Yeah, and you know what's so fascinating about this topic is like how often we just reduce menopause down to hormones, right?
Right.
But it is so much more complicated than that. This is a huge biological shift, a psychological shift, and it's happening to a massive portion of the population. So the mental health aspects of it, we can't ignore those, not for our patients and honestly not for ourselves either as clinicians, many of whom are going through this too.
That's such a good point. It's not just theoretical. I
But
mean, we're talking about, get this, something like 2 million women in the U.S. entering perimenopause every year.
wow.
That is a lot of people who are potentially, dealing with mood disorders or other mental health challenges.
Yeah.
And it's not just statistics either. I mean, we've got folks like Dr. Cheryl Spitzer-Resnick, Dr. Vanessa Haygood. They've been really open about seeing this firsthand, both in their patients and, even personally.
Of course, and it makes sense when you really look at the biology, right? It's not even just about what the hormone levels are, but these
Yeah.
huge swings that are happening during perimenopause. I mean, they can really throw the brain for a loop.
Oh,
We're
absolutely.
talking estrogen, serotonin, GABA, all these neurochemicals that are so vital for mood, for sleep, for just thinking clearly. They're all in flux.
Yeah. And that actually reminds me of, I think it was the NAMS report, the North American Menopause Society. One of the things they highlighted was this fear that a lot of women have that they're developing early dementia when they're going through perimenopause.
Oh, wow.
And when you think about it, it makes sense. If you're having those cognitive symptoms,
Yeah.
like Dr. Spitzer Resnick was talking about women forgetting common words, struggling to find the right word, it's easy to jump to that conclusion. And that must be so scary.
Absolutely. And, while we haven't found a direct link yet between menopause and, say, major depression, the research is very clear that women are much more vulnerable during this time.
Right.
And it's not just the hormones, right? It's like this perfect storm. You've got the hormonal changes, but then you've also got everything else that tends to be peaking in midlife in terms of stress aging, parents, career transitions, kids leaving home, relationships changing. It's a lot.
And that's where, I think we see the cracks in our healthcare system
Yeah.
become really obvious,
Yeah.
right? Because trying to actually diagnose and treat mental health
Yeah.
in this population, it's incredibly hard. I mean, you've got limited time with patients, you're battling insurance companies. There's still this like undercurrent of sexism in medicine.
Mm-hmm.
And frankly, I don't think we're training doctors well enough on how to deal with this.
No, absolutely not. And then on top of all of that, we've got this huge question of hormone replacement therapy.
Well, yeah, HRT.
Yeah, HRT. I mean, the 2002 Women's Health Initiative study, while it was so important for highlighting certain risks, it also like really scared a lot of women and a lot of doctors away from HRT.
For sure.
And that's had some really unfortunate unintended consequences, especially for women who might actually benefit from HRT, not just for physical symptoms, but for their mental health too.
And this is something that Dr. Green has talked about a lot, right? She
Right.
had this front row seat to that whole thing unfolding, and she's been really vocal about needing to understand the difference between relative risk and absolute risk.
Yes.
And I think one of the things that gets lost in all the fear is that for many women, the actual risk of serious side effects from HRT is really quite low, especially when you weigh it against the potential upside. But we're still not having that conversation, at least not consistently.
And we're still, I think, grappling with how to communicate all of this clearly to patients, right?
Mhm.
Because it's not one size fits all. HRT isn't just one thing. We need more research on all the different formulations, how they affect women differently, all of that.
Absolutely. And it's not just about HRT either.
Right.
We've got to understand the full range of treatments available, right?
Yes. It's
Hormonal and non-hormonal.
we've got different types of estrogen. We've got progestins, there's tibolone, there's estetrol, which is really interesting, by the way, because it's much more targeted in terms of the tissues it acts on, which is huge for side effects. And then, of course, depending on the woman, we might even be thinking about SSRIs.
And all of that while also recognizing that there are these massive racial disparities when it comes to menopause care, right?
Absolutely.
I mean, women of color are already facing more barriers to mental health support in general, but then you add in the
Yeah.
menopausal transition,
Yeah,
and it just feels like it's that much harder to get the care that they need.
for sure.
And that's kind of where I see the limits of some of these alternative therapies, right? Like phytoestrogens, CBT, acupuncture. Uh, they all have their place, but they're often not enough on their own. And access is a huge issue for so many women.
Yeah, and that's why, the most important message we can be giving our patients is that menopause is not a disease. It's not something to be afraid of. It's a transition. And if we can manage it well, women can not only get through it, but they can actually thrive. They can feel really empowered.
Hmm.
And this is where it gets really interesting, especially in light of this Danish study that we came across.
Okay.
It kind of throws a little bit of a curveball into some of the stuff we've been talking about HRT and depression.
Oh, really? What did they find?
So they found that women who use what's called systemically administered HRT, so think like not the localized vaginal estrogen, especially if they were under 50, had an increased risk of being diagnosed with depression.
Wow. Okay. So that does seem kind of counterintuitive, right? Like
Does.
we've been talking about HRT as being potentially beneficial for mental health.
Exactly.
And now we're seeing this study that's saying, well, hold on, maybe not.
And I think that's what's so important about this research is that it's a good reminder that it's not always so simple as HRT good or HRT bad.
Right.
There's so much nuance.
Okay. So how do we make sense of that then?
It really, I think, just emphasizes the need for personalized medicine when it comes to menopause.
Mhm.
And this is where our expertise, I think, as
Yep.
endocrinologists and psychiatrists is so important.
For sure.
We need to stay on top of the research. We need to be aware of the nuances of all these different HRT formulations.
Right.
And most importantly, we need to be listening to our patients.
Yeah. Listening seems to be a theme
Right.
with good menopause care, it seems like.
Absolutely. It's about understanding their individual medical history,
Yeah.
their risk factors, their preferences, all of it.
Okay. So going back to this Danish study for a second, you said there was another finding that you thought was really interesting.
Yeah, so to make it even more complicated,
Okay.
they actually found the opposite effect with local estrogen.
Oh, wow. Okay.
So women over the age of 54 who are using like a vaginal estrogen actually had a lower risk of depression.
Really?
Yeah, so isn't that fascinating?
That is fascinating.
So we have these two different groups. We have younger women, systemically administered HRT, higher risk.
Right.
Older women, local HRT, lower risk.
Totally different.
So it really begs the question of like, what is the mechanism at play here?
Yeah.
Is it that maybe the local estrogen delivery sort of avoids some of those systemic effects that could be impacting mood?
Interesting.
Or is it that women who are seeking out local treatment, say for something like vaginal dryness,
Yeah.
are already having maybe a different constellation of menopausal symptoms and potentially are at a lower risk of depression to begin with?
Yeah, that's a good point.
So more research definitely needed
For sure.
to tease all of this apart. But I think, until we have those answers, the big takeaway is we just need to be really thoughtful
Yeah.
and really approach HRT with, I think, a lot of humility.
Humility. I like that.
It's not about being pro HRT or anti HRT. It's just about understanding that it's complicated
Mm-hmm.
and we need to be considering the risks and benefits for each individual.
So informed consent is really important.
Critically
You
important.
can't just be like, oh, yeah, HRT, here you go. It's the cure-all for everything.
Exactly. And let's not forget about all the non-hormonal options too. We've got SSRIs, we've got SNRIs, those can be so effective for mood.
Yep.
Things like cognitive behavioral therapy can be really helpful for some women.
Yeah, and I think it's funny
And then of course,
how much we rush to medicalize everything,
yes.
right? And forget about lifestyle,
Exactly.
which seems so basic, but
Right.
sleep, exercise, stress management, these things are powerful.
Right.
And especially for women who are hesitant about HRT or for whom it's not appropriate for whatever reason,
Exactly.
these things can be really, really helpful.
Foundational.
Yeah.
So important.
So it comes back to that personalized approach,
Absolutely.
really understanding what the patient needs.
Meeting them where they are, figuring out what their unique needs are, and then, tailoring our approach based on that.
And, it makes me think about what you were saying earlier about, like, the disparities that we see.
Right.
Because it's one thing to talk about personalized care, but it's like, that feels like a luxury that some women just don't get when it comes to menopause.
Yeah.
And especially, we were talking about women of color.
Yeah.
What are some of the concrete ways that those barriers play out?
So, I mean, It's multifaceted, right? It's not just access to healthcare, although of course that's a huge part of it, but we also know that women of color are more likely to experience more severe menopausal symptoms, but less likely to be offered treatments like HRT. And then on top of that, you might have cultural stigmas around even discussing these issues. Yeah, plus the systemic racism that we see in healthcare can mean that their concerns are being dismissed or minimized.
Right, and it's like we're almost treating menopause as this like isolated hormonal blip instead of this like major life transition that's intersecting with every other part of a woman's life.
Exactly.
Her career, her relationships, sense of self, her cultural background, like all of it.
Yeah, and that's what I loved about that piece from Harvard Medical School. They were talking about the what they called it the unholy trinity of neglect. Women's health being understudied, aging being stigmatized, mental health being pushed aside. And it's like, yeah, that's kind of the crux of it, right?
It is, and it's not even just about individual women's well-being, which is of course the most important thing, but it's like
Right.
the ripple effects on society are huge.
Absolutely.
When women are struggling during this time, it affects their families, it affects their workplaces, it affects their communities. And it's like we're talking about a huge loss of talent, of
Yeah.
leadership, of brilliance.
Exactly. And it's time that we really reframe this whole idea of menopause. It's not a disease, it's not a failure.
It's not the end.
It's not the end. It's a transition, it's a new chapter, and it can be a really, really positive time. I mean, it has its challenges, but it can be a time of incredible growth and transformation and, frankly, badassery.
I love that. Okay, so as we kind of wrap up this deep dive, the question I keep coming back to, and I hope our listeners are thinking about this too, if menopause is so universal, if it affects women so profoundly, shouldn't mental health be front and center in how we manage it? It shouldn't be an afterthought.
Right. That's the million-dollar question, isn't it? And I think as medical professionals, as researchers, as humans, we have to start to embody that shift. It's time to prioritize women's mental well-being during this time, to give them the support that they deserve so that they don't just survive this time, but they thrive.
So well said. And, we've just scratched the surface here today, but hopefully this has sparked some curiosity. If there's one thing you take away from this, it's to keep learning, keep asking those questions, and keep having these conversations because it's so important. And, think about how you can take these insights back to your own practice to better serve your patients.